Some people don't know that a pregnant woman can actually have hypertension in pregnancy, and that the hypertension in pregnancy can cause her to die or cause her to have stroke, have pulmonary edema, or start having convulsion that may cause her to be admitted into intensive care unit, or even affect the baby that is in the womb, make the baby not to grow and have what is called intrauterine growth restriction. These are some of the complications. Hello, my wonderful viewer. I want to welcome you once again to my YouTube channel. Thank you for joining me today. It's been a long time that I made any video, nor posted any video on this channel because of my busy schedule. But it's important that I talk about this medical condition that can result in the death of a pregnant woman. I'm going to be doing a series of lectures on this channel from now as regarding conditions, medical conditions that can cause a pregnant woman to die. It pains me a lot when I see a pregnant woman die or start because of the blood that she's losing. That is the essence of this video. So today I'm talking about hypertension in pregnancy as one of the major causes of death amongst women that are pregnant. Or that some people don't know that a pregnant woman can actually have hypertension in pregnancy, and that the hypertension in pregnancy can cause her to die or cause her to have stroke, have pulmonary edema, or start having convulsion that may cause her to be admitted into intensive care unit, or even affect the baby that is in the womb, make the baby not to grow and have what is called intrauterine growth restriction. These are some of the complications that could arise from hypertension in pregnancy. Please, if you like what you are doing, before I forget, don't forget to subscribe to my YouTube channel. Subscribe, like, and then help me to share this video. Make una help me share this my video so that other people wey no sabi about hypertension in pregnancy go sabi am, because I have seen many pregnant women coming down with stroke, convulsion. Some of them, by the time they are bringing them to the hospital, either the woman is already dying or the baby has already died. That is excellent of the video. Now, what is hypertension in pregnancy? In case you're meeting me for the very first time, before I forget, my name is Dr. Eze Chidebere. Now, going down to the details now. What is hypertension in pregnancy? Hypertension in pregnancy means that a woman that is hypertensive in pregnancy, that the blood pressure of that woman is greater than or equal to 140/90 millimeters of mercury, and it must have been measured at least 4 hours apart in 2 different occasions. That is hypertension in pregnancy. One thing I want you to understand is that a woman that is hypertensive in pregnancy may be because she has been hypertensive before she became pregnant, or she now becomes pregnant and then starts having hypertension. And then if a woman that is hypertensive in pregnancy is having protein in her urine, and that pregnancy is up to 20 weeks gestational age, that means that type of hypertension is the type that is called a preeclampsia, and that preeclampsia is the form that can result in eclampsia, that is convulsion due to hypertension in pregnancy. Eclampsia. We have to understand some of these things. The question now is, how can a pregnant woman know that she is having hypertension, and then how can she prevent it? What we have found out, what I have personally found out, is that most pregnant women that come down with hypertension in pregnancy with its complications, most of them don't used to book for antenatal, or if they book for antenatal, they don't used to go for antenatal visit. And then also some of them that will be diagnosed of hypertension will tell you that it is not their portion. Because of that, they don't used to take their medications. Now, what are you supposed to do as a pregnant woman immediately you miss your period? One of the first things you're supposed to do is to register for antenatal in a good medical facility. It is not just enough to be pregnant. If you are pregnant, you register for antenatal, and when you register for antenatal, ensure that in any medical facility you are going to, that they have checked your blood pressure and they have checked whether you have protein in your urine by doing a test that is called urinalysis. So if you are booked for antenatal in any medical facility, be it maternity, be it clinic, and they have not checked your blood pressure and also telling you your blood pressure, please go out of that medical facility and go to another place that they will check your blood pressure and at least check your urine to know whether there is protein in your urine. It's important you do this. Then also, if you have gone for antenatal and they check your blood pressure and there is elevation of your blood pressure, please go to a good gynecologist or a good obstetrician, so that they will place you on a good antihypertensive medication. That drug, please make use of it. Take your drug. What I have also found out is that most pregnant women that are hypertensive, that know that they are hypertensive, don't used to take their drug, because they are not taking their drug. Their blood pressure will be so much high, and some of them may even start having signs of heart failure because of that, because they are already having pulmonary edema. Please take your drug, take your medications. Don't say it is not your portion. And then go for your antenatal checkup. Even if you are not hypertensive as a pregnant woman, ensure that you go for antenatal checkup. And as you go for antenatal, also make sure that they check your blood pressure and they check your sugar, whether there is protein in your urine. For any time you go for antenatal, be regular with your antenatal. These are some of the things that can result in the death of a pregnant woman, and then most of them are coming down with it. Hypertension in pregnancy is common in our environment, and this is the necessity of this video. Please, I want you to help me to share this video so I can get to many people as much as possible, so that they will learn about what I have just taught in the video. Thank you so much as you help me to share the video. Thank you so much.